everyone. My name is Latasha Harrison. I am the CEO of the Plug Network. Today we have a wonderful panel to sit here and discuss COVID-19 updates since COVID is running rapid through the community. And we wanted to have a great discussion on what are preventions, what we can do now, and where do we go from here. Today's panel guests, we have Dr. Burns, Dr. Sarah Hartledge, Deborah Payne, and Catalina Cordova. Hello, Deborah.
Hi. Thank you for the introduction, Latasha. We're very happy to be here. We have a great team of folks that are here to share their experiences and knowledge. And we do a quick introduction. Dr. Burns and Dr. Hartledge have been with us for through the last several months, helping host listening sessions to help share information and connect with people in a very unbiased way, to share ideas and give facts, to help counter the misinformation that is within our communities and how we can figure out what is true and what is not. So they're very helpful, very knowledgeable, and they're going to share their information with you today. We have a chat, and we encourage people to add their questions to the chat. But I guess starting out, Dr. Burns, would you like to give us a little bit of where we're at right now with COVID-19 and the Delta variant?
Certainly. Well, with COVID-19, unfortunately, we're not in a very good place. We were about a month and a half ago, but unfortunately, we're in the midst of a continued spike in cases. The vast majority of people involved are those that are unvaccinated. And we, as I said, we're having a large spike in it right now, and it's primarily due to the Delta variant. The Delta variant also was known as the 1617, originated in India, and it has over the past several months become the predominant variant here in the U.S. Presently, just so you know, our vaccines are still safe and effective and work against the Delta variant. But as I alluded to before, at this point, it appears that the vast majority of cases in this pandemic is primarily due to the unvaccinated. But that's pretty much the state of the pandemic right now at this time.
Thank you. And Dr. Hartledge, would you like to give us some details on where we are in terms of statistics within the city and what we're seeing at the hospitals, what we're seeing in terms of infection rates?
Yeah, absolutely. So as Dr. Burns alluded to, we are our numbers are so bad right now that we are approaching the highs that we had in early 2021. Our incidence rate right now is about a little over 60 cases per 100,000 members of the population. And we entered the dreaded red zone when we crossed over 25. So we're deep into that number now. We had 3,226 new cases last week, and at our peak early this year in February, we were getting about 4,000 new cases a week. So we're almost at that level of the records again. Our hospitals are quite full. The ICUs are quite full. Lots of folks on ventilators, and we did have 14 new deaths reported last week. Unfortunately, we are seeing partially because there's less vaccination in the younger age group, we are seeing more hospitalizations and unfortunately even more deaths in the under 50 age set. So back when we were talking about this a year ago, the deaths were generally in 70, 80, 90-year-olds, and while we are still seeing those folks on our list, we are unfortunately getting 30-year-olds on the list as well.
That's a challenging situation. Dr. Burns, can you give us a glimpse at what our vaccination rates look like in Louisville right now, and what we would hope to see would help curb the current spike in COVID-19?
Okay, well, I don't have those specific numbers. I believe Dr. Hartledge may have those.
Okay.
but I do believe that more people are getting vaccinated now than were at the beginning of the month. But as I said, Dr. Harless, I think may have more information.
Yeah, the numbers are trending up a little bit in terms of folks who are coming out and getting that first shot, taking their first step. We have roughly 60% of our population has had at least one shot. And if we only include those who are 18 and up, it's actually 72%, which is great. The number of folks who have completed their entire vaccination series is a little over 400,000, which is 52% of our population. But as Dr. Burns said, the one silver lining in this Delta wave that we're having here is that after several weeks of lagging vaccination numbers, we are seeing those go up again and seeing people come out and get vaccinated for the first time.
I know one of the things you spoke about is about the children, and I know as a parent myself, my whole family got vaccinated because we have a 4-year-old in the house that doesn't have the opportunity to do so. And what's going on within the school systems, like we see the numbers in the school systems, what can parents do to prevention measures to ensure that it doesn't hit their home?
Well, primarily, as you said, they're under the age of 12, so they're not eligible for the vaccine at this point. So for the younger children, we have to use the mitigating measures. That is, things that have been in place before. Masking, social distancing, and getting them to wash their hands. And one of the best ways we can protect the children, especially in school, is having the people who are eligible to be vaccinated, to have those types of people around the children. That is, have fully vaccinated people around the children. Between that and continuing the mitigating measures, those are actually some of the best things that we can do to help protect our children in school at this time.
Okay. So they say that now they have different mandates where, some places you can, you're not mandated to wear a mask, like indoors, outdoors, because they say that the spread is less contagious when you're outdoors versus indoors. And I think there's a whole lot of confusion going on with that. What are your suggestions when you're in different spaces on what we should do?
Okay, well, primarily, if you're, just speaking in general, if you're outdoors, not around a crowd of people, at this time, it's okay to not wear a mask, if you're walking through the park or in a very open area. But I believe the confusion has come from the fact that at one time, you may remember they said people who were fully vaccinated, for all intents and purposes, didn't need to wear a mask. And that was true up until the Delta variant came along. Because of the Delta variant and how contagious it is, even for fully vaccinated people, it is possible, even though they may not be symptomatic, that is, if they have a breakthrough case, they may not be symptomatic, but they could still, the potential is there for them to actually spread it to people. So because of that, CDC reviewed things and said that they felt it was safer for people fully vaccinated to wear masks. So in truth, everyone, especially indoors, should be wearing masks. And of course, the other mitigating measures as well, too.
Okay.
Yeah, I would say if you're inside and you're over age 2, you should definitely have a mask on. And if you're ever in a situation where you're not sure if it's needed or not, it doesn't hurt to put it on.
Okay. So how do a whole lot of people have different fears of getting the vaccine, and is one of the reasons why they have not received it. Can you talk about, the safety of the vaccine?
Well, the vaccines are safe and effective. They've gone through the clinical trials. A lot of this information is available online. The CDC has been extremely transparent with this entire process. And again, the vaccines are safe and effective. They've trialed it not only in the clinical trials, but also we have now what's called real world experience. That is, since the vaccines have been out since December and up until this point now, looking how the numbers have trended, and they also have looked how safe the vaccines have actually been. Again, it is just emphasized and indicated, as they did in the clinical trials, that the vaccines are not only effective, but they are safe as well too. All three of the vaccines, the two mRNA vaccines, the Pfizer and the Moderna, along with the Johnson & Johnson vaccine, again, all been shown to be proven safe and effective. I'm not sure where the fear comes from. I believe if we're talking fear of getting the shots and what happens after the shot, I've emphasized many times that people may feel sort of viral type symptoms. That is, they may feel tired, they may have headache, they have muscle soreness. They may have viral type symptoms that occur from the vaccine shot, but those symptoms are actually temporary and only resolve. And the truth of the matter is that is a natural effect, because that is your immune system getting cranked up, getting ready for battle. Again, that dies down. But you compare that and contrast that to these symptoms that you get with COVID. Unfortunately, those symptoms, and we're finding in our so-called long haulers, that those symptoms may not go away for quite some time. So really, looking at the fear of it, I just can't overemphasize how safe and effective these vaccines are.
Okay, great. Deborah?
Yes, can you talk a little bit more about the long haulers, COVID, either one of you, and what are some of the symptoms, and do we see a sign of relief in the future for those that get COVID and don't recover?
Well, with long haulers, because this is all new, that is COVID in itself, this SARS-CoV-2, some people do have the continued symptoms of COVID. Some may have loss of taste, loss of smell for a long period of time. One of the biggest symptoms that people identify with, that is these people with long haulers, is the so-called brain fog. That is the slowness, the decreased mentation. Again, these are just some of the symptoms that are involved. Unfortunately, we don't know a lot about it. We're continuing to learn. So we're at a point where we're continuing to study. Again, we don't really have the answers, but there are clinics that are actually available that these people can attend. And there's no treatment, but there's more monitoring and just observing patients just to see how long and if or when they do recover from these prolonged symptoms.
There's also some early evidence that folks who have COVID long haul symptoms, who go ahead and get the vaccination, some of them do see improvement in their long haul symptoms after they've been vaccinated, which is something we don't totally understand yet, but it's a bit of a happy accident for folks to have discovered.
So can we briefly talk about, one of the concerns in the community is that you see that some people that have been fully vaccinated still can get COVID and possibly pass it to others?
Sure. You first have to understand, no vaccine is 100%. So it is possible to have what we call breakthrough infections. Breakthrough infections is defined as a fully vaccinated person that actually has ended up getting infected with COVID. Now, what they have found, however, that even though these people have been fully vaccinated and some that do get infected with COVID, they've noticed that either A, they have no symptoms, B, they have very minimal symptoms, and C, and this is very, very rarely, those people have to be hospitalized. So far, to my knowledge, I don't think there's been any deaths associated directly with fully vaccinated people that have gotten COVID, unless they may have some other comorbid type condition. And what I mean by that, though, someone who may be immunosuppressed for whatever reason, they may have advanced HIV, they may have had stem cell or solid organ transplants, unless they have some of those other factors associated with it. But in general, person who is fully vaccinated will either usually be asymptomatic or B, have very minimal symptoms.
Deborah, you have any more questions?
Sure. Can you talk a little bit about the conversation around boosters and what that might look like? Do we have any updates on when one might need a booster and why we need a booster?
So right now, the only people who are specifically approved for a third shot are people who have moderate to severe immunocompromising conditions. And those are the ones that Dr. Burns was just talking about, those people that may be undergoing cancer treatment or have advanced HIV. They may be immunosuppressed because of drugs they take after an organ transplant, things like that. So right now, those are the only people who are specifically approved for a third dose. And that is because they may not have had a full and complete response to the first two. So those people, my recommendation would be that they seek out their primary care physician to confirm their eligibility, and then get hooked up to get that third shot. And they are eligible right now. There's been a lot of activity in the press about, are we all going to need a booster, right? So some people are saying 6 months, some people are saying 8 months, but regardless, it does seem that that's the way the wind is blowing, that we will be giving out boosters for people who have had 2 doses of an mRNA vaccine at either a 6 or 8 month interval. And I expect that we'll have some guidance on that from the FDA within the next week or two, as they have their next meeting. And locally, we continue to have sufficient capacity to administer those doses as it comes in. So the supply is not limited the way that it was back in January, where we had to be very careful about who was going to be able to get their dose and when they could get it and where they could go. So it's a different situation than we were facing then. It does seem like the boosters are what's coming next, but I would emphasize that the most important thing is to get a first dose into as many people as possible. So if you're someone out there who hasn't had a dose at all yet, don't think that someone else getting their third dose is going to protect you without you getting your first dose.
Dr. Burns, can you speak a little bit to the idea of herd immunity and why we would want to increase the numbers and how many people we need to have with a vaccine before we have this idea of herd immunity?
Well, the idea of herd immunity basically illustrates the fact of having a large number of people vaccinated around others who may not be vaccinated. In which case, the people who are unvaccinated for whatever reason would be protected. The problem with that, however, is that we actually need extremely high numbers for that to occur. But anyway, that's sort of the concept behind herd immunity. Now, having said that, for this particular disease, and herd immunity, by the way, it varies from disease to disease. As far as number of people or percentage of people vaccinated. With this particular disease, however, it's looking as though we have to have an extremely large number of people vaccinated for something like that to occur. So, and I've heard projections upward of 85 to 90% of the population being vaccinated in order to achieve the quote unquote herd immunity. I think probably the best way to look at this, however, is that I think we should just try to vaccinate as many people as possible. And then by getting as many people vaccinated as possible, that instead of looking at it from a herd immunity standpoint, we can say that, people are vaccinated, the virus has no place to replicate, thus no place to mutate. And then these different variants will no longer occur because the vaccine will, I'm sorry, the virus will eventually die out because you have enough people vaccinated. So again, like Dr. Hartley said, instead of people who are already fully vaccinated, we're working on booster shots. But the most important thing is for everyone to get at least their first shot. Everyone needs to be fully vaccinated.
So can you tell us a little bit about the amount of time that's gone into this particular vaccine or this set of vaccines? I know there's concern that it came out really quickly, that there wasn't enough research, and how should we trust it if it's only a year old, or what we think of as a year old?
If you're looking for research, I would say that at this point, this is the most highly studied and scrutinized drug in the history of mankind. I totally understand that it seems like the trials were done quickly. That you can look back, and much of the underlying technology for mRNA and for the vaccines has been developed over a period of decades, since really about the 1970s. But admittedly, this is the first mRNA vaccine product to come to market. So anything new carries some scary things with it, and that's understandable. The trials were done quickly, but they were done at very, very large scale, really larger than you would have strictly been required. And the reason that they did that was so that they could move quickly. And then hundreds of millions of doses have been given in the months since the emergency use authorization was granted. And so they are continuing post-market surveillance and looking for side effects or severe side effects. But so far, everything is generally looking rosy. The Pfizer vaccine has received its full authorization for adults. And as the process has gone all along, I would expect to see the Moderna product receive a similar authorization within the coming weeks or to months. And then we expect to see that step down to the younger age groups in coming months as well. So definitely want to validate that it's totally understandable to be afraid of something that's new, but want to also reassure that this is just the next step in a group of science that was already ongoing. And like I said, at this point, I think we can confidently call this the most studied drug of all time, with the number of hundreds of millions of doses that have been given across the world.
And I agree with everything Dr. Hartley said. In addition, you can look at the real world experience since the vaccines had been out up until the early part of July. As you go back and look, you can see how effective they've been. And we're heading toward the door that we could shut on this pandemic at that time. They were very effective, and as I said, we were almost there.
I do have a question via my Louisville PTO Facebook page, and a parent was saying that they recently just pulled their kid out of school because of concerns of the COVID numbers in school and not being able to have NTI. And they're trying to figure out what can they do as parents, what can we do as a community to help the schools.
Well, as far as COVID and protecting the children, again, even though they may, I still believe, and Dr. Hartley can tell me if I'm wrong or not. I still believe there's still a mask mandate for Jefferson County schools. But again, wearing masks, social distancing, and washing hands. Also having the adults, the people over at the age of 12, are that is within the schools, having them fully vaccinated. That's probably about the best protection right now until the children are eligible to have vaccines. And like Dr. Hartley indicated, that should be coming soon. The last projection I heard was before the end of the year, but again, that should be up and coming. But until that time, I believe that's probably about the most that can be done.
Yeah, that's exactly right. So I know there's been a lot of political wrangling over masks in schools, both here and across the nation. And There was a court ruling that led Governor Bashir to rescind the mask mandate. However, there remains a mask mandate in effect from the Kentucky Department of Education. So we do still have masking requirements in schools for both students and teachers or any other adults who are in the building, which I think is great. It's an absolutely vital step for those kids who are under the age of being able to get the vaccination. And then, it's those same mitigation measures, washing your hands, staying home when you're sick. That's a big one for kids. Even if it's not COVID, if your kid has some kind of symptoms, keeping them at home is important. And we do have cases in schools all across the city. I've got the numbers. At JCPS, we have a little over 700 total cases. The Catholic schools have about 75, and the other private schools, if you aggregate them all together, they have about 70. So there are cases out there no matter where you turn, really. So we do the best we can to mitigate spread. And if you have a child in school, as I do, I am certain that my child will wind up on quarantine at some point during the year, and we are just holding out to see how long we can go before it happens. So it's going to happen to all of us, even if we do our best job, probably.
So I guess we can go around and do like a roundup of everybody's thoughts or anything that we didn't cover. Dr. Burns, would you like to go first?
I think we covered the topics fairly well. Again, I cannot overemphasize the fact that people who are unvaccinated need to get vaccinated. We could be out of this pandemic if everyone was vaccinated. So again, that's probably, I think, the major take home message that I would emphasize is for people who are unvaccinated, get vaccinated.
Okay, and Dr. Hartledge?
So I won't repeat what Dr. Burns just said, although vaccination is probably the best step we can take. From a health department standpoint, I would also emphasize that if you get a call from a contact tracer, to please answer that call and talk to them. We're all trying to work together toward the same goals, and nobody's trying to get you in trouble or anything. Your information is kept private, but it's important that we be able to get that information so that we can track clusters and hotspots. It's very important. And if you get a call or if you have a positive test result and you have not yet gotten a call, you're always welcome to call us on the hotline. The helpline is 502-912-8598. It's 24/7. There's always someone available. And if you don't get through right away, you can leave a message and they'll call you back within 24 hours.
Okay, is Catalina Cordova? Do you have any comments?
I think you were a bit quiet. I'm not sure if you were maybe muted for that last statement.
Deborah, do you have any roundups?
Thank you. Sorry, I couldn't hear you. I just want to say thank you for hosting this session this afternoon. The health department is doing everything they can to help the community stay healthy, and we feel like these conversations are really valuable to help share information, to build confidence, to build trust. And we are here to answer questions, and we'll continue to. If you would like to have another session, we're also happy to do that as well. So thank you, LaTasha, for all of your hard work in working with the Louisville PTO. And that's what I have.
Thank you all so much for giving out this information. It's very important that we educate our community so that we can do better. Thank you for tuning in to The Plug.